So they are also very sneaky. They are very curious. They are very good at taking things that they're not supposed to be able to open and figuring out ways of opening them. They're very good at finding things that you hide, right? So this is all what kind of leads to this group being a little, higher risk for poisonings and ingestions. So when you look at the data from, surveys of the U.S. Poison data centers or poison control centers, most pediatric poisonings are from medications, illicit drugs, plants, actually, cleaning products, pesticides, and solvents. So those are kind of the top ones that are of consequence. 90% of these occur in the home. And sorry to say it for loving grandparents out there, but grandparents' homes are 4 times more risky for poisonings than parents, both because I think often they aren't maybe necessarily thinking about keeping things childproofed in the same way that a parent who has them in their house every day does. But, visit to grandma, sometimes things are left out. And also grandparents actually are on medications that are a little more risky for kids, just more often than some parents are. So I think that might account for that, even though grandma's house is generally a super fun and awesome place to be. My mother might be listening on here too, so I have to say that now. Most of these are actually preventable, which is good. So we're going to start with our potions, and we're going to start in the medicine cabinet. Surprisingly, many medications that are over the counter are very dangerous in overdose. We sort of joke that some of them probably would not be approved by the FDA to be over the counter if they had been introduced in a time when that was a thing. Okay. So one of the most dangerous medications is Tylenol in overdose. Tylenol has what we call a very narrow therapeutic window. That means there's sort of a very particular dose where it works. And if you overdose, it really harms you. Okay. So you can take, the adult limit for Tylenol is 4 grams in a day. Okay. So that's, if you take 2 of the extra strength, a lot of people do, I think that's a gram. You do that 4 times in a day, you're at your max daily limit. If you take 6 grams or 8 grams of Tylenol, so like 1.5 to 2 times the daily dose, you could go into liver failure, especially when you're a tiny person. Okay. So, we do everything weight-based in pediatrics, so we look at the kind of per kilo dose and how that, but, either way, not much extra Tylenol can really create problems. So that's one I think people are often the most surprised about. The nice thing is there's a great antidote for it or treatment for it if you get the care soon enough. The other one that we really get frustrated by the pediatric ED is Benadryl. So Benadryl, which is diphenhydramine, is very common, used for allergies. It's what we kind of call a dirty drug. So it's not very specific. It acts on many different receptors in the body. So that makes it just have a lot of side effects, which you may have experienced, sleepiness, agitation, whatever. It also helps you not itch, right? But it really can cause a lot of problems, arrhythmias, seizures, all kinds of things in overdose. So that is also one that we don't love to see when a kid comes in having drank a bottle of Benadryl. We know that we're up for a long time in a long treatment time in the ED. Aspirin, many people know this. Aspirin is on the one hand unsafe for children because of something called Ray's syndrome, which is a sort of a interaction in the body when you take aspirin while you have a viral infection, generally influenza, and it can make you super sick. But aspirin itself in overdose can really mess up the acid-base balance of the body and lead to some dramas. And then cough cold preparation. So I know that when your kid has a cold, it's really hard because they can't blow their own nose and they're miserable and they can't sleep and nobody else sleeps and all these things. So of course, everyone wants to find something to try. I had an old medical school professor that said, when you go to the pharmacy and there are about 12 different options to treat one thing, you probably know none of them work. Which I think there's some wisdom to that, right? People say, okay, we're going to try Robitussin. Well, that didn't really work. So now we're going to try, Mucinex. That didn't really work. Now we're going to try this. So none of them really work very well for anyone. At most, they can make your kid zonked and sleepy, which can give some relief for everybody. But they actually have very dangerous side effects. Dextromethorphan and benzonatate are both quite dangerous in overdose, mostly due to arrhythmias. So not only are they not medicines that don't really work, but they don't really help that much either. So the abuela stuff is really good, like honey and tea and lemon and steam and all that stuff. The other reason that cough cold medications don't work well in kids is because they can't blow their nose well. And all of those, the reason those work is they dry up your secretions and they make them more sticky and not flowing, which makes you cough less and sneeze less and snot less. However, it gets all that stuff stick and like thick and sticky, and then it gets harder to get out. So you actually can kind of set kids up more often for ear infection. So that's my soapbox about cough and cold medications. I will get off of it now. Ibuprofen is another one. This is a lot less dangerous than Tylenol. So if you're going to pick one to overdose on, pick ibuprofen. Okay. You can take about 15 times the daily dose and still be fine. It's cleared by your kidneys, which tend to be a little, deal with it better than your liver does with Tylenol. So obviously I don't want you to overdose on anything, but we don't worry that much about ibuprofen ingestions, even if they've taken quite a lot. Remember, a lot always come in liquid formulations that are flavored to be yummy. I mean, like sweet candy, like fake cherry flavor or whatever. So it's pretty hard for kids to take a lot of pills, but they can glug, glug, glug a whole bottle of Tylenol pretty fast, and it's actually pretty yummy. So just a couple, naproxen is similar to ibuprofen in that it can be risky, but is, not as risky as Tylenol in terms of the non-steroidal anti-inflammatory pain medications, pain and fever medications. Imodium, everyone's favorite problem of diarrhea, right? So it's loperamide. I tell people Imodium is really good if you're like me and you're here and you have to give a talk and you really won't want to have to go poop your pants, okay? It stops things up for a short period of time, but it actually has a lot of other risks and can cause a lot of issues in overdose. So that's one we don't generally want kids to be taking. A surprise sometimes too is Afrin. This is oxymetazoline. It's the nasal spray, for allergies and stuff. It's okay in your nose. It's not good to use more than a couple days because you get sort of a rebound inflammatory congestion response that can make you feel worse. But also, if you drink Afrin, it is very bad for you as a child. So, kids can get the little thingy off the top of the bottle and drink it. Benzocaine is actually generally hard to find now, but I still like to mention it. That was what was in Oragel. I don't know if you guys remember in the news, there was a big recall of Oragel because it basically interferes with the way that your hemoglobin, the little, boats that carry your oxygen on your blood, basically it interferes with their ability to carry oxygen. So you can sort of starve your body of oxygen paradoxically with benzocaine. So it's hard to find, but you still can get it. I looked on Amazon, you can still buy it as of yesterday. And then when I get into some of the, some supplements and vitamins and things, iron supplements, there is sort of an iron overload effect that can be unpleasant. So those aren't great in overdose. Melatonin, I see a lot of kids who overdose on melatonin, and they usually are just extra sleepy, and it usually is nothing really to worry about. But there are case reports of kids taking very large doses who needed breathing tubes and things like that. So, even though I know that's becoming more and more popular, and a lot of times it also comes in kid-friendly forms like gummies. So just being thoughtful about that as well. If they really eat the whole bottle of gummies, it could lead to some dramas. And these shouldn't necessarily be in your medicine cabinet. I mean, we're in Colorado, so cannabis is probably in a lot of medicine cabinets, so that may be, but we're seeing a huge spike in cannabis ingestions in kids, and that's really related to the form that it comes in. So gummies, again, brownies, candy, right? So kids that come in with that, there have not been any fatalities in Colorado in pediatrics related to cannabis ingestion. There have been a handful of kids who needed ICU level of care and a lot of kids who needed hospital care for some period of time. We kind of call them the sleeping beauties because they look like sleeping beauty. They're asleep. They have generally very normal vital signs and they look very comfortable, but you cannot wake them up. And there's no reversal agent for this. So you just sometimes they need some oxygen or some breathing support because sometimes they can start to get in such a deep sleep that they breathe shallowly, but we let them sleep for like 27 hours and then they wake up and it's I'm telling the truth, they really are very hungry when they wake up and they always want Doritos. So the munchies are real. Liquid nicotine, I also like to mention too, because these are the things that like to go in your vape pens. They're highly concentrated nicotine, and nicotine itself is actually very toxic to kids in that concentrated form. So we've had some cases where kids have like been able to open the containers of the liquid nicotine and drink them. So, all right, that's a lot. So this is sort of the over-the-counter common, what most of you probably have at least 2 of these in your house, I'd imagine. So just to kind of keep in mind, Tylenol really again is the one that I always tell people about. Okay, these are not dangerous. Okay, most vitamins. We have a lot of kids that try to, the parents that come in and they ate the whole thing of gummy multivitamins, and if they have iron in them, that can lead to some issues, but you generally they're fine, their body's going to pee it out. So most vitamins are water soluble, which means that if your body has more than it needs, it just pees it out. You'll see some doctors say, like, Doc, should I take a vitamin? And they're like, well, you'd have expensive pee, because if your body doesn't need, is getting it through food, it's just going to literally pee out all that extra vitamin C it doesn't need. The exceptions are the vitamins A, D, E, and K. In medical school, we learned this is the AHEC vitamins. These are fat soluble. So these will be stored in your fat, okay? So it takes a lot to get toxic levels of any of these. Vitamin K is pretty uncommon in the oral form to begin with, but A, D, and E are pretty common. And so A is sort of the riskiest one. You can get hypervitaminosis A. These are super unusual, but just know with the supplement market and, buying things online and you don't really know what's in them. We do see some people that are taking, not even realizing how much they're taking. Probiotics, those are really popular too. Those are not adverse effects. So, there are a lot of things in the house that, you think might be concerning that are actually not. Okay, this is important to say, and I don't like to ever be really fear mongering, even though I feel like I've started kind of like, oh, Tylenol can kill you. But, this is sort of a national campaign from the DEA called One Pill Could Kill. And this is an awareness campaign for pediatrics specifically. So because remember, kids are small, an adult dose is going to be, for them, is going to be very different from what their body should be seeing. That even one dose of certain, generally adult medications can be fatal in a child. So these are ones that we really want to make sure if you have these in your home, you are locking these up. You're making sure that your child has no access to them. If they do have access, you're immediately bringing them to the emergency department, okay? And they generally, fall into a few categories. So diabetes drugs, okay, particularly the ones that are oral, we call oral hypoglycemic. So they make your blood sugar low, right? If you're a tiny child and you take a big pill of glyburide or glipizide, your sugar could go down to like almost nothing. And then, your body has no way to run itself, right? Cardiac drugs. So these are generally calcium channel blockers is the class of drugs that a lot of these are in. And then the other one is beta blockers, all right? So these affect the heart rhythm and they affect blood pressure and heart rate. And so similarly, one pill of these can put a kid into a fetal arrhythmia. One pill of these can drop their blood pressure to nothing. Okay, so amlodipine, nifedipine, diltiazem. I'm giving the generic names. On the next slide, I'll give some brand names as well. Clonidine, propranolol, and metoprolol. Anything that ends with olol is a beta blocker. Okay, so those, and these are pretty common for a lot of people, middle-aged and older, especially who are dealing with diabetes, high blood pressure, heart failure, things like that. So they're very common. We all know about opiates. I don't really want to go into that too much because I think thankfully there's been a lot of public awareness about this, but fentanyl is the one that we all worry about because it's just very, very, very concentrated. Methadone, which often is used for people who are in recovery from opiate use disorder, is also a one pill can kill. And then oxycodone, it usually takes one of the larger dose pills to do a lot, like a 10 milligram. But these are all things to know about. And I will say this, to everybody, there is a reversal agent for this called Narcan. It is free to get in multiple places in Colorado, including your pharmacy. It's a nasal spray, and it immediately puts you into withdrawal, which is, I don't think, maybe a very pleasant experience for the person, but definitely saves their life. Psychiatric drugs, these are some older ones that aren't used as much, TCAs and something called chlorpromazine, which is Thorazine. So those are kind of older generation, but they are making a little bit of a comeback for other uses. So they're around. And then if anybody happens to be traveling to somewhere super fun where there also is malaria, chloroquine and quinine are also on the one pill can kill list. This is publicly available in a lot of different sites. But, if any of these in our home, these are the ones to particularly pay attention about. What we often see happens is kids, like the baby's crawling on the floor and finds a pill under behind the toilet and then licks all of it and chews it up. And then, I've had a bunch of these cases come in and we're literally trying to looking at pictures being okay, so it's green and I think it's oval and it might be Zeta's, trying to figure out what it could be. So we know if it's one of these drugs or not, because a lot of times the families don't necessarily know, because if kids take any of these, they generally will be admitted to the hospital for generally 12 to 24 hours. Okay. So here are some other prescription medications that are not one pill can kill. So this, you need to take a lot more of them to be dangerous, but are also sort of on that list to be mindful of if you have these in your home and there are kids around. Ozempic, which everybody knows about, woohoo, that's very popular now. And then again, the other hypoglycemics. Insulin is fatal in overdose, but you have to inject it. You can't eat your insulin to overdose, okay? Blood pressure drugs, as I mentioned. Blood thinners is another one. These are very common, right? There are always TV ads for them, right? Xarelto, right? That's the one I always hear about. Xarelto, Eliquis, and then Coumadin. All those just an overdose are going to make you bleed, which is internally bleed, which is not usually good for you. Some anti-seizure drugs, Lamictal, Tegretol, and Depakote, and then a bunch of the psychiatric medications. I would say SSRIs like Prozac and Celexa and things are ones we very commonly see in our patients who come in for overdose. Those don't tend to be as much accidental overdoses, but they are very high risk. Stimulants as well, those generally or make you feel really hyper and you can have some arrhythmias and feel really oh, but you have to take a lot of them unless they're the long-acting forms like Concerta. A lot of these medications, part of the issue is some of them become in extended release forms, and so their effects are going to last over 24 hours. So that we treat those a lot differently in overdose than the things that only have a short half-life. And then, so yeah, your SRIs, your stimulants, your antipsychotics, like Zyprexa, which is olanzapine, and then anti-anxiety like Xanax and Ativan. Those can make kids stop breathing and overdose. Sleep aids and muscle relaxants as well. Ativan's one of those too, but Ambien, I feel like Ambien's got a little bit of a favor because of some of the, everyone knows about the really weird stuff people do in Ambien, but Flexeril, which is a muscle relaxer. Okay. So these are just, if you're coming in to our emergency department and you ingested any of these, we're gonna, it's a perks our ears up. Okay. So this is something that I think people don't always know. So containers, the pill containers that y'all get, they're not childproof, and they don't say that they are. They are meant to be child resistant. Okay. Children can open them and they do all the time. Okay. So that just, keep that in mind. You can get a false sense of safety from that. Okay. All right. So we're going to get out of the medicine cabinet for a little bit and go under the sink. Okay. This is super common things too. So high risk things. All right. There's a lot that you think is not that should be high risk that is not, and a lot that you might not think that is in this category. So high risk cleaning products. Most of them are things that are very caustic and actually things that are more basic. So have a higher pH are often more dangerous than things that are more acidic, which is a little bit paradoxic. But the higher pH, the basic things are actually more damaging to tissue usually, like if you swallow it. Oven cleaners, Windex, rust removers, wood cleaners, and borax are kind of the main ones. Okay, laundry detergent itself is not so much to do, it's the darn pods. You all know what I'm talking about, the laundry pods that look like candy. There's a particular kind of candy in Colombia that looks exactly like them, I learned from a patient whose family had brought some when they were down there. those are very concentrated. They look like candy. They're like bright colors and look like kind of gel, like a gummy or jelly. And the concentration of them is what the issue is. And so biting and swallowing one of those can lead to a lot of esophageal injury. Perfume, if you drink it, because it's mostly alcohol, okay? I guess depending on how expensive or cheap your perfume is. And then essential oils. So I love things to smell nice. Like I use these in my laundry and all that kind of stuff, but they actually, plants are powerful. Most of our medicines have come from plants, right? Aspirin is a great example. Digoxin, all these things. So essential oils, when you ingest them instead of just smelling them or putting them on your skin, some of them are very dangerous, actually. And again, they're concentrated, right? The process of making an essential oils, it concentrates the things that make it smell nice, but also it concentrates the things that can be dangerous. So camphor is fatal if ingested in kids. Eucalyptus oil causes seizures. Sage as well. Wintergreen oil acts basically like an aspirin overdose. Same with peppermint and menthol. Tea tree is also another, pennyroyal, and then nutmeg can also. So all of these, some of them I don't think are as popular, but just kind of keep in mind a big old swig of these is doesn't just make you smell nice. Okay, so not high risk. All right, so there's a lot that you think should be dangerous that is not, like Drano. Like Drano is actually not, it sounds like it should be horrible, but we don't really do much at all for it, actually, unless you drank like an entire bottle, but I've never seen anybody do that because it tastes so bad, So most all-purpose cleaners, like the sprays, they're soap, just going to be bubbly. Most liquid laundry soap, laundry fragrance boosters. I don't use these, but they're like little pellety things, I guess you shake in. Stain removers. Most bleach is actually not very toxic if you swallow it. Okay, with the exception of the ultra bleach, which has sodium hydroxide in it. That's the more concentrated ones. Especially now, most bleaches are made more dilute on purpose. And also they taste horrible. So I've had probably like 2 bleach kids in the last like 2 months, maybe. And generally they just got it like on their lips and they and it's splashed all over the clothes. It's easy to know what they just because they smell. So I mean, they come in reeking of it, right? But they, we watch them for a little bit. If it's gotten in their mouth, we watch them for a little bit, making sure they can eat and drink. Most kids don't ever drink enough or get it far back to be an issue. And again, the kinds that are sold mostly now are so dilute that it's not the same as maybe it was, earlier in the life of bleach. Disinfectant wipes. I don't know who eats those, but if you did, I mean, they're not going to do much. We've got a lot of sunscreen and toothpaste eaters. Okay. Toothpaste, it's hard to eat enough toothpaste to get a fluoride overdose. And fluoride overdoses are not really, they're not super dangerous. They can have some other kind of longer term complications, but there's toothpaste, you can eat a lot of it. And then shampoo and conditioner, again, generally that's not going to do anything. So we have a lot of people come into the ED for these things and we're like, great, okay, you look good, thank you. Please, try not to do that again. And you might be burping bubbles, but most of these are not too dangerous. Okay, now we're going to the garage, just adding to more fear mongering here, right? So potions in the garage, car stuff. I think people know these, right? Gasoline, lighter fluid, but don't drink antifreeze. Like these are very dangerous. These are hydrocarbons in general, which cause a lot of tissue injury as they go down your gullet, okay? House stuff, paint thinners and removers, alcohols, methanol and rubbing alcohol especially. Most people don't drink those, but some people can have. And mothballs, they have naphthalene, which is quite toxic. I don't know if people use mothballs anymore, but I remember my grandma's always did. So garden stuff, pesticides, rat poison. Most rat poison is warfarin, which is Coumadin, which is a blood thinner that a lot of people are on, right? It kills the rats by making them bleed internally. So you don't want to do that to you. And then there are certain plants. I'm a big gardener. And so I always feel bad when I'm talking about toxic plants. But remember, plants are powerful. Plants are the source of medicines. We've just figured out what works and purified them and made them safe, right? When we give them as medicines. Foxglove, that's where digoxin comes from, digitalis. Okay, so that makes your heart, gives you heart arrhythmias. Oleander, hollyberries, English ivy, and European mistletoe. So these are the most toxic plants that you'll find if you eat them, okay? I don't think most kids eating them, to be fair. Usually we see kids coming in with, rashes and things. And then just to think about, this is not a substance, but well, I mean, it is, but it's not visible. It's carbon monoxide. So I think many people have a lot of awareness about that to keep their CO detector, keep the batteries in it and test it and make sure that if you're using generators or, grills or camp stoves, even all these kind of things that they're in a well ventilated space, because really it's the lack of ventilation that causes the issue. There is an antidote for carbon monoxide poisoning called methylene blue that you can be treated with it for that. Okay. But most of these are going to cause all of the, like a injury to the esophagus, right? Or to the lungs if you inhale it a lot or ingest it. Okay. Last thing in potions is we're going to go to the playroom. So these are the only 3 things you need to know if your kid is eating a random object, okay? Because they put a lot of things in their mouth, okay? Button batteries look like this. They're often in watches or a lot of small toys will have them, okay? These, if they get into your esophagus or your lungs or anywhere in your gut, actually, really anywhere, they start to conduct current in the acidic environment and they erode the tissue. So they burn a hole into it within hours. Okay, so please keep this away from your children. They just announced that certain brands are putting a bitter taste coating on it that prevents or is supposed to make kids not swallow them because it tastes bad. There is something to do though at home if this ever happened to you and you're pretty sure that that's what it was, even if you're not, it's very safe, is have your kid glug a bunch of honey. Okay, so there are actually studies that show that honey coats the battery and inhibits its ability to create current for at least a short amount of time. So they did a lot of animal studies and then did some kind of case reviews, and this really helped reduce the amount of injury to especially the esophagus, okay? Not any magnets, these little buggers. Buckyballs is the brand that a lot of people know, these little tiny rare earth magnets that are like a desk toy that are really fun to play with because they're really tiny and they all stick together and they're super strong and you make things, okay? If you get a bunch of, I've seen kids die from this when I was a resident, so the problem is not one, but many, right? So you eat one and it goes down and you eat a bunch more and they all go down and then they all go to different parts. Your intestines go like ziggy-zaggy, right? And so they all go in different spots and then they fight each other because they're really strong and then they make a hole and they perforate your bowels. So they put holes in your gut. So, oops, what did I do? So don't use those. And then these are a new thing. I didn't even know what these were until 2 years ago, and everybody's eating them now. Because they look like candy. Don't they look like candy? They're water gel beads. They're sold as a toy. I literally got this picture from the Amazon ad for buy these gel beads. So you see they start off tiny and then you put them in water and they get really big, which is super fun. It's like the opposite of Shrinky Dinks when I was a kid, if anybody remembers those. But you don't want that happening in your intestine, you swallow. So really the issue with these is not what's in them, it's that they become these expansive things. And if you eat a whole bunch of these and then, they expand, then they can block your intestine and perforate it and all kinds of stuff. So sometimes I've had a few of these recently and the parents brought them in and we put them in a thing of water and watch them for several hours to see how much they would expand, because not all of them expand the same. So some of them are going to get bigger than others. So, okay. So these are all, please don't come, you don't need to come to the ER for this. Okay. Any of these things with a few exceptions. Coins. Oh my gosh, the number of kids that swallow coins is a total thing. Okay. It's kind of fun in the x-ray to figure out. It's usually quarters are the ones that get stuck most, but paper clips, thumbtacks, even some of that stuff, usually it goes through the gut without an issue. Necklaces, tiny rings, parts of earrings, those are fun on x-ray too, because you can see the, oh, it's a dolphin or whatever. Play-Doh comes out looking exactly the same as it went in, just a little dirty on the outside. Okay. I remember I was seeing a patient for some other reason, and the mom's doing the diaper opening, and I'm like, oh my gosh, that looks like blue Play-Doh. She's like, yeah, that's what she ate 2 days ago. I'm like, oh, it looks exactly the same. Doll shoes. Ball shoes go in noses and ears a lot too. Glow stick fluid, those ones that crack, and the stuff in that is actually not toxic. So if you break it and kids lick it, that seems to be a thing. It's not worrisome. And also like bubbles, just to blow bubbles. So we see a lot of kids come in for these things. Now the exceptions, and this is usually with coins, it's if your kid has swallowed something and they can't breathe or they can't eat or drink, and they're going, come in, you know what I mean? Like a quarter can in a small kid get stuck right here, okay? But most of these are going to pass through without an issue, and you're just going to poop them out and it's going to be fine. Okay. All right. So just some basic, you guys probably all know this, but I always like to reiterate it. So, keep your potions safe. All right. Keep all medications in their original containers. Part of this is for the child resistant packaging, but also so you know what's in it. Okay. I had a toddler once who came in drunk as a skunk, and we couldn't figure out how they could have ingested that much alcohol because it would just taste bad, but I guess somebody an auntie or someone had like a party and made pina coladas and stored it in like a container. It looked like formula to whoever like got up in the morning, and they fed this baby like a 8-ounce bottle of pina colada, which she chugged down. So again, like keep things in their original. I don't know what the original pina colada container was, to be fair. That's not the best example, but still, store medications, cleaning and button batteries, blah, 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 everything up high. Use safety latches or even locks. So what I tell people is crawl around your house, literally get on your hands and knees and crawl around your house, and then you will see how high you need to put things. And then start to stand up as your kids get bigger, right? You're going to see a lot that you wouldn't see if you get yourself at a kid level, okay? And there are lots of, like devices you can buy, safety latches, different things that can work. Keep pills off the floor, okay? If you drop a pill, find it. Okay, don't let it stay there. Mostly for the fact that, this usually happens when people are visiting someone's house and someone's puts their purse down and the pills drop out and then they leave and the kid finds the pill and then we don't know what that pill was, right? So it's if you and you dropped your Benadryl and you did, just make sure that you find it so your baby can't eat it later off the floor, but when we don't know what it is, it just makes everything a lot trickier because we worry it could be one of these one pill can kill things, and we have to watch kids in the hospital for a long time. And then dispose of unused medications. There are a lot of pharmacies that have local programs where you can return your medications. There's specific ones for opioids, but also for other things, okay? Especially if things are expired. Expired medications, a lot of them still work, so it just, having those around doesn't make life better either. Okay, this is what if you don't take anything from this talk, take this. This is the poison control number, 1-800-222-1222. This is the same no matter where you are in the whole country. They are my favorite people. They're super nice. They're super smart. You call them and you say, my kid ate Pert shampoo, and they'll be like, oh, that sounds delicious, but you don't need to worry, okay? Or my kid ate one of grandma's glybride pills. Okay, you have to go to the ER now. Okay, so that's what they will tell you. They are experts at triage. They are experts at knowing what's dangerous and what's not. What I always find, a little frustrating for families is they come in because they're worried, which they, I understand why they're worried, right? They are concerned about their most precious thing, which is their kid. And we know that too, So a lot of people are coming in for things that they don't need to come in for. And if they called poison control first, it would have saved them a visit. So if your kid looks okay, they're conscious, they're breathing, they're not blue, they're talking and walking and whatever, you generally have time to call poison control and they'll help you know if you need to go in or not. They also can give you some good advice about home care if you don't need to go in, or sometimes they want you to do some home care, like with button batteries. They'll say, you have any honey, glug the honey, and then go, okay? They can, so they're awesome. We love them, and they're 24/7, 365. They also have on their website now, like a cool, I don't know what the technical, it's like an app kind of, right? Where you type in your question and it responds in real time. So that, for those of people that don't like to talk to humans on the phone, which is, all of us at some point, right? This is another good opportunity. And, depending where you are, might be more accessible. So you can just program that into your phone too, the poison control number, make it easy to dial. Okay, all right. We're gonna move on to creepy critters for the kind of last half. Spiders! I love spiders. I have my spider pin on. I have my spider ring on. I love them. A lot of people don't, and I get that. Okay, so we kind of joke, like everyone always thinks it's a spider bite, you know what I mean? There's a lot of fear about spiders that isn't really deserved, you know? Most of the time it's not a spider bite. Okay, here are some bites. Woohoo, fun. Itchy, itchy. That's a spider bite, but that's not a dangerous spider bite. That's just like regular garden spider bite. Okay, so you'll see like the pair of punctate, like a vampire, you know, like little pair of holes there, and it can get red around it. You know, this is not immediately. This is usually within 24 hours. The rest of these are not spider bites. Okay, not spider bites. This is a tick bite, mosquito, bed bugs. I think that's just more mosquito or something. I'm not sure. Okay, so don't worry about this. They're super itchy. Okay. You can do some topical hydrocortisone, which is like the anti-itch cream over the counter, or not Benadryl. Zyrtec or Claritin or Allegra. They're all much better options. That's what the allergists recommend now. Okay, the two we need to care about, and they both are in Colorado. We see a couple every year in our hospital, are brown recluses. And I'm sure you guys know which one I'm going to say next. Okay, so here's our little friend, the brown recluse. Okay, they like creepy, dark places. A lot of kids I see get bit by them. They're like in basements or in barns, you know, things like that. The bite itself is painless, so you often don't remember getting bitten. But then within, you know, several hours, the area gets red and it does become painful. Okay, and then it gets real gross. All right, sorry, this is going to be gross, trigger warning. This is not actually that gross yet, but it starts to ulcerate and look like that. Okay, so like that doesn't look like, you know, it doesn't look like that, right? Looks like this, and then it starts to look like that, which is the gross picture. Okay, so it ulcerates, which means kind of the tissue erodes, almost like getting like a crater, and it gets what we call necrotic, which is dead. Okay, so all that is dead. So, and this takes months to heal. So the risk from brown recluse spider bites is not anything life-threatening unless this gets really infected and gross and you get like a bacterial infection. But this is just because of the wound care, right? So I think most people, when it gets to either this or this point, are going to come in. But just so you know, like this is what a brown recluse spider bites are gross. Okay. That's what they end up looking like. So if it doesn't look like that, it's not a brown recluse. Ironically, black widow spider bites don't cause much drama in the location of the bite. There's not much to see. So I didn't even put a picture because really you can often barely see it. It's usually 2 tiny punctures. The one thing that's unique is the skin around the puncture gets goosebumps, you know, so like which we call pillow erection medically, which is an awkward word. So but it just looks like the skin reacts and you get little goosebumps just around the area of the bite. So that can be one clue. But the main clue is this causes unbelievable pain. The kids I've seen with this it's really hard to watch. It's extremely painful within hours, the kind of pain that you cannot sit still, you're screaming, and then nothing relieves it. Opiates don't relieve this pain. It's very hard to control this pain. So the pain starts in the bite area and then spreads. It generally, you know, will then progress to, chest pain, muscle spasms, headaches, sweating. You can have difficulty breathing, vomiting, fever, chills, high blood pressure. You can get delirious. So this is all very late stage stuff. It causes a systemic reaction. So that's why black widow spider bites are concerning, because they cause more than a local reaction. Okay. And it's treated with antivenom. We have it here at Children's. A lot of hospitals have it. The zoo has a lot of other antivenoms for snakes and other funky things, but we generally have black widow spider venom available to us. And it's unbelievable when you give it. The kid goes from like shrieking and screaming their head off despite being on like tons of opiates and all the things, to be like, hey, can I get some lunch? Like totally fine within half an hour of the antivenom. It's remarkable. We had a very interesting case a couple of years ago of a child who came in with right lower quadrant abdominal pain that was very severe. And you know that we always think of the appendix lives there. So working on her appendicitis and all these other things, everything was normal, everything was negative. And then kind of got some history that they'd been playing in a barn and anyway, someone looked really closely and they could see the bite site. And so, you know, she had all these other tests and things before this was figured out, and she was a new person after the antivenom. So it's not subtle when this happens. Okay, there are also something called false widow spiders. These are not dangerous. They look like this. They look quite different. I think they have some of the similar-ish markings, but they're not as black, and they don't have that kind of violin, you know, or I don't know, the hourglass shape, I guess, is actually what people describe more as on their back. The bite is red, it's a little irritating, but it's not dangerous. Okay, it's just a local reaction. Okay, I'm gonna do bats, and I think we're gonna be fast through bats. So bats, woohoo! There's our little bat. They're high risk for rabies, which is a fatal disease. Bat bites are often small and hard to see. So that's the tricky part about it. You don't always can't always identify it easily. Bat scratches are also can carry rabies. And then I've had so many of these situations, especially when I was in training at Boston Children's, was there was a bat in the baby's crib. We found a bat in the baby's room, and we don't know how long it was there or what could have happened. And because these are so small, these scratches and bites we often can't find, we often will treat with the rabies vaccine for a bat in the room in a small child, okay? There's a vaccine series. It prevents rabies even after exposure. There's also something called rabies immunoglobulin we give you with the first dose, and you can get these at your local emergency department, okay? So you can't get rabies if a bat flies by you. You can't get it from petting a bat, and you can't get it from bat guano, bat poop, or pee, okay? It has to get in under your skin into the bloodstream. And so rabies, who gives it to us? It's really actually not dogs, okay? People worry about that a lot, but about 4,000 animal rabies cases in the US. So these are not animals that bite people. These are just animals that have rabies. So this is just looking at the like the zoonotic prevalence of it. 90% of them are wild. Bats are a third, raccoons are a third, skunks are 20%, foxes are 7%. These are the top ones. Coyotes carry it as well in Colorado. In Colorado, bats and skunks are the ones that are most responsible for cases. Some of these are through biting another animal like a cow, a cat, or a dog. So again, cats, dogs, and cattle are the other cases. So dog bites rarely require rabies prophylaxis, right? The exception is if you're like walking in the street and you get some dog comes out of an alley and just runs and lunges at you and bites you and runs away, and it's an unknown dog and you can't catch it, that's when we would give you the rabies vaccine. Okay, the Department of Public Health has a great website about this. So if you're ever unsure about like whether you should come in, if you've had exposure to any of these, they can help you decide. I will also mention that animal bites, dogs and cats are very high risk for bacterial infection. So even if it's a wound that doesn't need cleaning much or doesn't need to be sutured or anything like that, you do want to seek care to get preventative antibiotics. We're very thoughtful about antibiotics, but dog and cat bites, we always give you preventative antibiotics because dog and cat mouth bacteria are pretty gross if they get under your skin. Okay, so rabies is not the only thing to think of, but you know, dogs is what people know. That's not usually the issue. Okay, one last one, snakes. I'm not going to talk a lot about snakes because there are only a few that really matter in our state. In other parts of the country, they have a lot more venomous snakes, but rattlesnakes, okay, rattles, these are cute little guys. They have a triangular shaped head, they have a spotted body, and they have a distinctive rattle on their tail. And who's heard a rattlesnake before? Yeah, so you know, it's hard to imitate it. But in our state, the western Massago rattlesnake, the midget faded rattlesnake, and the prairie rattlesnake are the ones to care about. So just stay away from these guys if you see them on the trail. My husband saw one on a trail once and was like, oh, you know, don't go toward them, go away from them, especially when they're already rattling. Rattlesnake bite first aid, this is all I'm going to talk about. Okay, so call 911 right away. Okay, this needs treatment with anti-venom as soon as possible. Do not take time to look for the snake or catch the snake. Okay, we don't want the snake. Please don't bring us the snake in a bag. Okay, you're just putting yourself at risk. If most people know if it was a rattlesnake around here, I think, especially if people are used to doing backcountry or stuff. Okay, keep the injured still and lower than the heart. Okay, this is helping gravity work in your favor, okay? So if it's an arm or a leg, it's easy to do, but you don't want the person really standing. That's the other thing. I mean, they can stand or sit, but don't let them walk. It just creates too much exertion, but you know, if you have to get, sometimes you can't avoid this. Wash the wound, you can put like a bandage over it. Don't like, just try to, usually this is happening when you're in an external environment where there's some exposure issues, so just make sure people aren't getting too cold or too warm. You don't wanna kind of add that issue to the bike and then, or to the bite, and then get them to the ED for anti-venom treatment. Most of our EDs carry this, especially the ones closer to the mountains, like Boulder Community always has it. Please don't be like MacGyver or whatever weird, not, or that Australian guy, but I don't even know, who like slice open the area and suck out the venom, either with their mouth, or you can buy suction devices. They don't work. This is not gonna help. Don't put ice on the area. That just gives you hypothermia and there's no evidence that it works. Please don't get people drunk or give them caffeine, okay? Those aren't gonna help either. So that's just some first aid for that. And that's all I got. Comments, questions?
That was fantastic.
Sure.
Thank you.
And thank you. Here are my little ghouls last year. So yeah, have a safe and healthy outing.
Thank you so much.
Yeah.
Any questions from our Anschutz audience?
Let's see. You said that quinine was one of the like one pill can kill. Is the level of like tonic water dangerous?
No.
Do you know?
No, no. Thanks for asking that. No, tonic water will not do it. And you know, tonic water was, people realized in the malaria endemic areas that it was a treatment for it. That's actually how we sort of figured it out way back when. But no, it's the pills. So we don't use it very much anymore, but it is actually still a malaria treatment and a prophylactic that's in pill form. Yeah, and you know, when for those of you that have traveled, you know, a lot of what you're prescribed depends on the resistance patterns, you know, in the area you're going. And there still are some places where there's a lot of resistance to things except quinine, because we haven't used quinine very much in the recent past. So it's still around. But no, you can have your gin and tonics for sure. The gin is probably more the issue.
See, I've got a question from the chat. What about suction devices for insect bites?
Yeah, there's some of those on the market, you know, I mean, I think some of them work actually. They're just gonna probably make you feel a little bit better. There's really, unless you're actually allergic, right? If you're allergic, the suction device isn't really gonna do anything. You need epinephrine. You know, epinephrine is always a treatment for anaphylaxis, not Benadryl or steroids or suction devices or anything else, or Zyrtec. If the suction devices that seem to work will take out some of that venom that's left in, and they're going to reduce the local inflammatory response, so you're going to be less itchy and more comfortable. And itchy kids are, you know, that's kind of annoying. So sure, try them.
Thank you. So you mentioned so many instances that
Yeah.
you use like antidote or medication to treat those toxins. When what would be the ideal, maybe not the ideal, but the clinical picture where you have to do a gastric lavage in kids ingestion?
That's a good question. We really used to do them a lot more. We used to do activated charcoal, and you know, if you've ever heard of Ipecac, you know, to make you vomit. If generally if a kid has ingested pills, and it's within, it depends on the pill, 30 minutes to an hour, and we expect that a lot of them are not going to be absorbed, then we will do that gastric lavage depending on what the pill is. This is usually most of the time this is in a suicide attempt situation, because they're swallowing a large volume of pills that generally are going to be pretty toxic. And then we know that if they're not absorbed and we can get them out, we'll do gastric lavage. We almost never do it in other situations. We don't want to do it in things where like things that can be caustic. So that's not really medications, but usually like, you know, household like hydrocarbons and things like that, because then you're re-exposing all that tissue on the way up, you know. So and gastric lavage is something that is hard to do at home too. You know, there's a lot of people that are like, oh, make them throw up or whatever at home, and that often can just cause more airway problems and obstruction. And again, sometimes like pills can get stuck or other things. So generally, you know, we do a lot less of that, making you vomit or getting the stuff out as we used to. But we do still do gastric lavage sometimes, you're right.
See, I've got another one from the Zoom chat.
Yeah.
How dangerous is gabapentin?
Gabapentin, like an overdose, it's relatively concerning, yeah. It's not as dangerous as some of the other anti-epileptic drugs, but it is one that we would monitor you for in overdose, and then certainly, you know, depending on the dose. There's a wide like dose range for gabapentin, so some people are on pretty high doses multiple times a day, and so might have a lot of pills. So if you have somebody that gets a lot of doses, that matter, you know, a big dose that matters. But you know, that's one where more the poison is in the dose.
Thank you. Any more from the audience? We have some in the chat still. Not currently.
Is antivenom available at the urgent care for patients with snake bites? Should go directly to the ED?
Yeah, no, antivenoms don't have urgent cares don't have antivenom. Yes, not at all. Not every hospital has antivenom either. So, but I do think like, you know, the more rural parts of the state and the mountainous regions have it a lot more than you would expect, because time is important. Urgent cares can't do much with anything related to poisonings, I would say. So it's usually better just to call poison control, and they'll either they literally will tell you to stay home or go to the ER. They basically never tell you to go to urgent care. They just don't have the right interventions there.
All right, I've got one last question. So if you are hiking
Mm-hmm.
and bitten by a snake, how do you get to the ED without walking?
No, you can walk. I mean, it's just if you don't have to walk, then don't walk, right? Someone can carry you or you can come down. I guess that's I didn't say that clearly enough. First, call 911 on yourself, you know, if you're alone. You don't want to, I forgot to mention this, you don't want to tourniquet it either. I think that's a myth. People think, okay, if you tourniquet it, then you'll stop it from going systemic. There isn't data to really show that, and it can actually just cause more damage from tissue hypoxia to that area. So just get to professional help as soon as you can. Or at least if you're alone, get to a person. It's better to have a second person with you who could help you if you start to have more systemic symptoms and are not as aware.
Well, thank you. That was really impressive. Big hands for Dr. Bluntman.
That was fun. It was fun for me.
Thanks
Thanks
for
for
having
having me. Spooky.
And don't forget to fill out the survey at the end. And also join us next week for osteoporosis. Well, might have a clever title, but I'm not aware of it.
Something with skeletons.
Ooh, that's a good one.
Right, that would be good.
Thank you again.